Welcome back to New Day, and time now to talk about your health. And this morning we're talking about malaria. Now, the World Health Assembly instituted World Malaria Day in 2007. Now, the day is to enable countries in affected regions the chance to learn from others' achievement and also get the support of one another in fighting against the disease. Now, I'll tell you also that the day also gives international partners the opportunity to showcase what their contribution to the fight against malaria is. Now, a lot of issues we have recorded in this part of the country, Ghana. I'll quickly tell you the themes for the various years starting 2008. In 2008, we talked about malaria, a disease without borders. Now, from 2009 to 2010, we said counting malaria out. Now, 2010-2011, achieving progress and impact. Now, the theme for 2012 was sustain gains, save lives, invest in malaria. In 2013 to 2015, the theme was invest in the future, defeat malaria. In 2016, the theme is end malaria for good, invest in the future. That's the focus of our discussion this morning as we speak to the National Malaria Control Program. My guest in the studio is the Program Officer, Mr. James Frimpong. Mr. Frimpong, good morning and thanks so much for joining us.
Good morning, thank you.
Let's start from here. We are looking at building on the successes chalked in the fight against malaria. What are some of the successes we can talk about in Ghana here?
Well, thank you for having me here. When you mention malaria control, it's not like it started yesterday or last year. Ghana, since pre-independence era, has been doing something about the malaria problem that faces the country. And year on year, every government has tried to do something. But in recent times, coming from the years 2000, the early 2000s, because of the establishment of the Global Fund, we've had to source external resources to help us fight the disease. And every year we do evaluation of what we have done and assess it against the previous year. And so if we compare the years 2000 to date, we notice that successes have been achieved. For instance, in the year 2003, when the demographic health survey was conducted, only about 3% of households in Ghana had insecticide-treated bed nets, which is a tool for preventing malaria. Okay. As of 2014, when the same survey was repeated, about 68% of households in Ghana are protected from malaria through the insecticide-treated bed nets. If people went to the hospital complaining of conditions that were presumed to be malaria in the year 2000 thereabout, out of 100, about 40 to 50 of them were confirmed to be malaria. Coming down to 2015, if you take the same cohort of people, or about 100 people going to our health facilities to complain of conditions that were supposed to be malaria and they were tested, only about 30 of them were proved to be positive for malaria, which is an indication that the malaria prevalence among the general populace is come down. Way back in the early 2000s, it was postulated or estimated that the malaria prevalence in Ghana was about 70%. But in 2011 and 2014, two separate surveys. In the 2011, the multiple indicator cluster survey that was conducted among children under 5 years, who are one of the most vulnerable groups, examined the blood smears for the presence of malaria parasites. And out of 100 overall in the country, about 27 of them had the parasites in their blood, which means the prevalence then has come down. If you look at the 2014 demographic health survey, among similar children under 5 that were examined, their bloods were examined for the malaria parasite, it is roughly 26 to 27 of them. This is an indication that the malaria burden is coming down. Okay. But not until we have hit the era where we record 0 deaths, we will not say we have finished.
Is that possible?
It's possible. And I always cite the example of Morocco and Cape Verde. They are all African countries. They are on the verge of eliminating malaria. If they have not eliminated it completely, it's because probably WHO has not certified them as malaria free. But they are already putting their application for WHO certification that they are malaria free. They've been able to eliminate malaria from their territories, and Ghana too can do it.
What are the interventions that have ensured these demographics that you are talking about?
Good. You see, malaria control is something that you cannot employ one particular intervention. It's a combination of interventions that we have put in place. One, if you are controlling disease, you must first and foremost cater for those who are already sick, those who have had the malaria. And in that, we are advocating or implementing what we call prompt and effective case management. We advise that when people are sick, they seek care immediately, and once they get to the health facilities to seek care, the service providers must also treat them well, diagnose the case, administer the right medicine recommended, and take care of all their needs in terms of health. Two, for the general population who are not yet sick, we are promoting prevention. And the prevention, there are multiple approaches. One is integrated vector control, which employs the use of insecticide-treated bird nests, indoor residual spraying, and we are also targeting the mosquito larvae at their source where they are produced by adopting what we call larviciding. That is done on limited scale. The other one is that we are also encouraging the general population to manage our environment in such a way that we will not be creating mosquito breeding places. We know the mosquito that transmits the malaria parasites. We know where it breeds, and therefore we are saying that let's manage our environment to minimize the breeding sites so that we will reduce the mosquito population. For pregnant women who go to our antenatal clinics or who go to the antenatal clinics of health facilities, we are providing intermittent preventive treatment, IPT for short, to protect them and the unborn child or the developing fetus against malaria, because evidence shows that pregnant women harbor the malaria parasites in the placenta, and that leads to adverse pregnancy outcomes. It could be low birth weight, it could be stillborn, and all those unpleasant outcomes.
So these are the interventions. How would you, how would you react to the concerns of many that all these interventions could be enhanced if we concentrate on one, that is managing the environment, so that, like you said, we destroy the breeding places of these parasites. They argue that if you do that, the fight against malaria would have been won instead of these interventions and all that.
Well, it's a good argument, and but then I will not subscribe to that. The argument that one particular intervention could solve the problem, that we should concentrate
all our drains are closed. We can't resolve this.
We cannot resolve it because already people have parasites in their blood. Mosquitoes are out there already biting and infecting people, and so we cannot channel all the resources into managing the environment to the neglect of case management. That is, those that are sick, we cannot say we will not take care of them. For the infants who are under 5, we cannot say we will not protect them against mosquito bites. And so these things will have to go hand in hand. We do not have one single bullet to solve the malaria problem. So it's a combination of interventions that will solve it. And even that, we are not doing it alone as Ministry of Health. We expect other ministries, departments, and agencies to also play their part. For instance, we are talking of managing the environment. Obviously, the Ministry of Environment, Science and Technology,
the local government
must come in. You want to institute proper referral systems in the health sector so that when a pregnant woman or a child under 5 who is sick and has to be referred to the next facility or next level is referred. You need very good roads, you need efficient transport system to do all those things. And so every sector comes into play when you talk of malaria control.
Let's talk about the communication surrounding all of these interventions. How effective has the Ghana Health Service, the National Malaria Control Program, worked with these non-governmental organizations, private institutions in communicating the need even for behavioral change in this fight?
Very good. When you talk of disease control or any public health intervention, behavioral change is very key, because if you put out the interventions in the facilities and people do not go to accept them, it will not achieve the desired result. If we talk of people having all these tools that are there and they are not using it, the tools will not give you the desired results. So we adopt health education targeted at changing people's attitude and behavior, not only the general population but also the service providers. Because if I come to the hospital and the provider there doesn't know what to do, or even knows what to do but doesn't have the correct attitude, I might not get the service that I'm supposed to get. So we are embarking on behavioral change communication, targeting the population, targeting also the service providers. And we do not do this alone at the facilities. We intend to do this through the various media houses, the various media of communication. And to back up what we are doing, we also work hand in hand with lots of locally based non-governmental organizations, NGOs for short, and to sort of work in the communities with opinion leaders, queen mothers, chiefs, and district assemblies to educate the population on the consequences of malaria. You see, we have been living in Ghana since we were born. We've had to suffer malaria in our childhood. We suffer malaria during our school days. We suffer it in our adulthood. And it has become acceptable, sort of like a common disease. So people tend to live with it, not taking into consideration what the consequences are to the economy, to the society, and the community at large. So we want people to change that attitude. For instance, as I sit here, if I tell you now that I have malaria, you will tell me, oh, but that is just malaria. That shows the kind of attitude you have towards malaria. And we all do it in our homes. Oh, only malaria and you are shaking like some. We don't take it serious. So we want people to change that attitude, that perception, and begin to do things to prevent themselves and their households from getting malaria.
Let's shift attention to funding the fight against malaria. Of course, one of the key things is to enable financial investment into the fight. Is funding a challenge, and how challenging it is?
Yes, I will admit that funding is a challenge. Globally, there is a funding gap of about $3.6 billion US. And that implied also that Ghana is included, because Ghana have had to depend on the government of Ghana and its developmental partners to fund malaria control activities. And for us as a country, even internally, we know the challenges that the country faces in terms of several competing demands for the for funds. And so malaria control also is affected. And if we look at the global arena, we've had to depend on some of our partners to fund certain aspects of malaria control. And if globally there is a funding gap, it implies that we will not get what we need or what we want to fight malaria.
And we can't raise some on our own too. We are unable to do that.
We are unable to do that, but it is something that we are looking at and considering and have started putting in measures to interact with the locally based industries. In fact, the private sector is being consulted at different fora and on different fronts to sort of contribute to malaria control in the country. When I say they should contribute, I'm not saying that they should actually give X amount or Y amount. Okay. But they, in their small way, could also institute measures for their staff, their households. If, for instance, a company like CocoaBoard is providing bed nets for farmers, cocoa farmers in the western region and other places, that is an attempt to protect those people from getting malaria. AngloGold Ashanti, a private mining company, implemented indoor residual spraying in Obuasi and its environs. And that was a malaria control intervention they wanted to do for the society as a corporate social responsibility. I know of other corporate bodies that have sort of distributed bed nets to certain communities in and around Accra and elsewhere. Other companies can come on board. District assemblies and other municipal assemblies could also do things in their own way to help minimize the malaria burden in their catchment areas.
So these are, you think these are ways that these persons are supporting. But if you talk about the government supporting this fight, would you be able to quantify how much exactly goes into this and how adequate it is?
Well, talking of the state government per se, the Ministry of Health budget is the total budget for the health sector. And I want to say that I cannot quantify how much government is contributing in that. Every single person working in a health facility is doing something in respect of malaria control, including even the cleaner, who makes sure that the consulting rooms are cleaned, the walls are cleaned. Their activities has something to do with malaria control, because when sick people come, they will be taken care of at the facility. So I cannot quantify how much government is paid. All these people are paid by the state.
But isn't it that once government makes the effort, then it will draw the attention of the donor community to also come in and put in their support?
Yes, that is very true. I know, for instance, that the Global Fund is supposed to be complementary to what the state is providing. And we talk of what they call counterpart funding. So that if the Global Fund, for instance, is paying $2 million for malaria control, they will expect the government to pay, let's say, $500,000.
Okay.
And that they will want to see that this is the cash that the government has put down.
And
as
then they can
control.
also put in their support.
Yes, and this the government is doing. The government is doing that. But I'm unable to put a figure on how much government is contributing.
Yes. I'm grateful, Mr. Frimpong. But finally, so you think the fight can be won?
It can be won. It must be won. It depends on you and I. If I do my part to protect my household from malaria, and you do your part, then the entire community will be protected from malaria, and the country as a whole would have solved the malaria problem.
Mr. James Frimpong is the Program Officer of the National Malaria Control Program. Sir Frimpong, I'm grateful for your time this morning.